All right. Welcome, everyone, to another episode of Sickish, the podcast that has candid, open, and honest conversations on navigating chronic illness. Today, I have a very special guest by the name of Dr. Florence St. Jean. Dr. Florence, welcome to the Sickish platform.
Thank you. Thank you for having me. It's a pleasure to be here.
You're welcome. You're welcome. So, Dr. Florence, I mean, I know who you are, and many people who are going to be tuning in are going to know who you are, but introduce yourselves in terms of, what you do, where you're from.
Yeah, thank you. So, preferably, a lot of folks call me Dr. Flo, Flo, whichever, doesn't matter. I am originally from Brooklyn, still live here in Brooklyn, New York. I'm of Haitian descent, and I am the executive director and founder of a nonprofit slash clinic called Global Trauma Research, where we provide individual counseling, group counseling, 24-hour crisis intervention for our participants, as well as substance abuse intervention. And now we've recently added acupuncture and Reiki. Yeah.
What? Well, we're going to have to talk after this.
Yes, it's services for us, by us, including psychiatry and medication management for those who need it. And we've been doing it for several years now, since 2014. And it's been really effective in terms of increasing the language or the understanding of mental health, positive mental health, and mental illness in the Black and Brown communities, specifically Caribbean and African communities, as well as reducing symptoms. And we see all kinds of people that come in who are sick and distressed, hurting, in pain. And we can honestly say that after several weeks, months, maybe for some even years, when they leave us, they are better, which is, good news to report.
Yes, I love it. I love it. So, Dr. Flo, so we're talking about chronic illness on this show, and we know that there is a connection, right, between
Mhm.
individuals who have chronic illness and, mental health concerns, whether it be anxiety, whether it be depression. And so, we know that it can significantly impact a person's mental health. And I would like for you to maybe explain like why this is the case, right? Why is it that an individual who may be dealing slash suffering with chronic illness could have their, mental health impacted by this disease?
Yeah, great question. Thank you for that. Well, let's look at anything small, right? And when I say small, meaning something a little bit more understandable, right? So let's just say someone has a headache today. They wake up in the morning, maybe they didn't have breakfast on time, or they didn't sleep enough, they're dehydrated, whatever the case may be. And then they have a headache and they're able to grab a meal, take a nap, rest a little bit, eat something, drink some water. Within about, let's say, 3 hours or so, headache is completely gone and they're better, right? That's acute. That's an acute pain. And nothing else left there, right? They've solved the issue within 3 hours. But let's just say that same individual wakes up with the headache and they do everything that I just listed. In addition to, they take medication, Motrin, Excedrin, or whatever, and then they still have the headache. So by day one, they're a little perplexed. They said, okay, but tomorrow is going to be a better day. They wake up with the headache again tomorrow, right? And they do everything we just listed again. Maybe even try something else. Maybe try some herbal medicine. Third day, they still have the headache. Then by then, they're of course going to the urgent care. Urgent care says nothing we can do about it. Then by the fourth day, they're in the ER, right? Then by the time they leave the ER, they did CAT scans, no blood in the brain, no brain aneurysm. They just send them home. Now we're on day seven, day eight, day nine. At that point, to deal with that amount of pain 24/7 for 7 days a week, and I'm just talking about 7 days a week, 7 days, right? That person now begins to feel a bit hopeless about the headache, right? They
Right.
feel hopeless. They start to feel like incapable because they can't work, they can't probably take care of their children or function at home and in society like they did before because they have a radiating headache that won't go away. If we just look at it just like that, that is a clear indicator why mental health becomes a variable when we're talking about chronic illness, because we're talking about someone living with an illness regularly. It's a part of their everyday life
Mhm.
and it affects their functioning, right? Whether it's something that causes them to be has a fever, to be ill regularly, or it causes physical pain, right? Emotional pain. At the end of the day, you're going to start to see that person start to feel hopeless. The moment a person feels hopeless about their current state or their future state, that is a gateway or a bridge to mental illness. And mental illness can be anything, or mental health symptoms. And even if you don't get to a point where it's illness, but anywhere where someone is, whenever someone experiences sadness for more than 2 weeks, they are already at borderline depression, right? Or they're worried, they're constantly worried about this illness on a day to day basis, weekly basis, then they're already at borderline anxiety, right? So we just tackled two mental illnesses just by talking about hopelessness.
Right. And as you mentioned, like the word hopelessness, I'm like, that's exactly like that is spot on. I think that, with many of us that are dealing with chronic illness, it's that idea of like, is there hope for a better
Yeah,
future? Am I ever gonna get over this? And I guess that might be one of the differences between somebody who has maybe like an isolated health concern, right? That it's not necessarily persistent, and
yeah,
somebody who's dealing with in a situation that is lasting, for more than a few days and months even, right?
absolutely.
Okay, okay. So I want to kind of talk about maybe some challenges, right? So
Mhm.
are there any specific like factors or challenges that are unique to I guess chronic illness in a way that contributes to the development or exacerbation of mental health issues? I know we kind of you talked about the headache scenario, right? But
Mhm.
just thinking, a little deeper about any unique factors, unique challenges that kind of really like compound the mental health concerns, issues, conditions.
Yeah, well, when it comes to mental health, right? So let me actually start by just defining what contributes to a mental illness. And when I talk about mental health, when I talk about trauma, I always use a ruler as an example, right? You have 12 numbers on the ruler. Anywhere from 0 to about, let's say, 5 or 6 is stress, right?
Mm,
And that also could be connected to a traumatic experience. So anyone can go through a traumatic experience and anyone can experience stress. And it's not necessarily specific to, okay, it's a chronic illness versus a car accident versus anything. It's really about how a person experiences that particular issue and what it does to them. And if it does something to them and they experience a symptom as a result, then they now transition from stress and traumatic experience to numbers 7 to about 9 or 10,
mm,
where now they're experiencing distress. That means the stress has now affected them and it has caused distress. And
mhm,
the trauma experience has affected them and now they are traumatized. Moving from there, then you get to the far end of the ruler where you're anywhere from 10 to 12. So if you don't do anything in the moment of distress or when
mhm,
you were traumatized, if you don't do it, there's no intervention, there's no impact, nothing that alleviates it for you, then it's going to form an actual illness. Now that could be a physical ailment like high blood pressure, diabetes, etc., or it could be a mental health illness such as we talked about earlier, depression, anxiety, or more serious mental health conditions such as PTSD, borderline, acute stress disorder, etc.
mhm,
So I wanted to explain that first because what happens is that most times when someone gets a diagnosis or they're experiencing chronic pain for the first few months or weeks, they're at the first end of the ruler,
Mhm.
1 to 6, right? It's just the knowledge, knowing about it. And then they have to manage their condition, their physical condition, their ailment, right? So that could be following the doctor's protocols, getting medication, maybe doing their own treatments or remedies, communicating with their family, getting a community of support. People are coming in and they're supporting them. Then they may not necessarily get to the place of distress where this chronic illness is causing them emotional distress. The challenge, though, is that because chronic illness comes with so many responsibilities,
Mhm.
that oftentimes people will transition from stress to distress or the trauma to traumatize.
Mhm.
Because let's just say, for example, someone who's diagnosed with fibromyalgia, right, which causes a lot of physical pain, right, chronic physical pain, that person doesn't have the ability to work oftentimes anymore. And if
Mhm.
you can't work and you don't have a community of people that are coming in and saying, listen, I got you, I'm going to take care of this, I'm going to cook, I'm going to clean, I'm going to pay your bills, you know, if you don't have that, then you're going to start to worry and you're going to transition over to distress. And the
Mhm.
person transitions to distress and they don't have maybe a counselor or community people that they can talk to, they can express themselves, they can use their coping mechanisms or learned coping mechanism, then not only are they now dealing with this chronic illness, but now they're dealing with a mental illness. So I don't know that it's actual chronic illness. This is not a cause and effect, right? So chronic illness doesn't cause mental illness. What happens is it's all the other variables that come with the chronic illness that now contributes or correlates to the mental illness.
I
I hope
love
that
that.
answers your question.
No, you definitely did. And I think you brought forth a lot of clarity because I think a lot of times when we have this conversation around mental health and chronic illness, it's the idea that, well, I have a chronic illness and that's why I'm experiencing mental health issues. And so I like how you were able to really break it down and have us understand that it's not necessarily the chronic illness itself, right? But it is like the surrounding things. And it's true, you use fibromyalgia, but I have a friend who has had lupus for maybe, almost 20 years, but
Mm,
went to college with lupus, went to law school. Law school was very, as a, law school is hard, right? Anybody who's been to law school, we know these professional schools are difficult. And so
yeah.
that stress in law school exacerbated her already, brewing lupus, causing kidney failure, all these other things. But then
Yeah.
that also then contributed to the mental health concerns, because now you're not just concerned about what you're doing in law school or what your future might be, might look like. You're concerned about, well, I have a kidney that's also failing and I don't know.
Mhm.
So all of that surrounding surrounding stuff definitely impacted, I can say, her mental health, and
And
how
you
she
know,
operated.
you're saying something that's so interesting because they're both for your friend's example, they're both feeding into each other. The mental illness
Mhm,
feeds into the chronic medical illness that is feeds into the mental illness. So, for
mhm,
instance, right, we know that lupus is a debilitating disease.
mhm.
However, oftentimes the symptoms that people experience with lupus is triggered by stress.
Right.
So her being in law school is stressful an environment in itself. So that now triggered her lupus. Her lupus now triggered all these other ailments in her body, right? And then now when she's not able to fully perform at her full capacity in law school, that leads to that hopelessness, that now leads
Right.
to additional. It's a cycle.
Cyclical.
Yeah.
Yeah. It's definitely cyclical. And I think that that's why sometimes people latch on to, well, I have chronic illness, so I'm depressed. And I
Hmm.
think that I love how you broke it down, because it's like, for me now, I'm thinking we have to kind of move away from, well, I have this and that's why I have that, and kind of see it as like this, like maybe like a cause and effect, but not necessarily I automatically have a chronic illness, so I'm automatically going to be depressed. I'm automatically going
Yeah.
to have anxiety.
Yeah, no, because interestingly enough, we serve GTR, we service a wide range of individuals, and there's a lot of factors as to what a person who has a chronic illness, what will create a mental illness in their lives, right?
Mhm.
One major factor, and it's not specific to chronic illness, it's actually just specific to the mental health profession in general. One variable is motivation. When a person comes in and they are motivated, they say, doesn't matter what it is, this thing is not going to overtake me, and I'm willing to do the work. I'm willing to do whatever it takes. Then I realized that their symptoms will show up different. Didn't Is motivation specifically the thing that alleviated or decreased their mental illness? No, but it's a major contributor. It's a major variable because the moment
Mhm.
that they are motivated, then they say, "I'm willing to do all the techniques you gave me, all my homework assignments, right?
Mhm.
To challenge my history of trauma, right? I'm willing to ask for help. Maybe I never did that before, right? Maybe I'm willing to tap into other parts of my life that I didn't before, like spirituality, whatever. And then from there, I'm able to feel a little bit better because we've seen people with chronic illness who are extremely joyful, actually,
Mhm.
right?
Mhm.
Um, and they're managing they're actually not even stressed about that. They're stressed about other things like their children, or their finances, right? But not necessarily the illness itself. But then we have people who come in and it's all about the illness, right? And it doesn't take away from anybody's experience. It's actually makes it very beautiful, in my opinion, because
Mhm.
the reality is that it's very subjective.
Right.
It's not it's not the situation itself that affects the person, it's how they experience the situation that affects them.
Right.
Yeah.
And I think that's so important. Like as you're talking, I'm thinking about like the power of like mindset and
Mhm.
how, when people are, whether they're sick, not feeling well, whatever the case is that, if their mindset is more positive, there may be more positive outcomes. If their mindset is settled in negativity, they're, maybe they won't feel as good as they could because their mindset is rooted in negativity. But I think that that's all important because again, I like what you said. This is also subjective, right? And a lot of times, when individuals, when we either first find out we have a chronic illness, we go straight to the internet and we're looking for, what is the world saying about what it is that I've
Mhm.
recently been diagnosed with. And the first thing, you'll see a lot of times is, oh, depression, anxiety. Like, so it's almost as if you kind of marry the two. And so that mindset of, well, this is, I'm depressed because I have
Yeah.
a chronic illness. A lot of times that takes over. But I like, how you explain that, and I would probably challenge anyone who is tuning in, to it's not the easiest thing, right, to kind of like jump in and say I'm going to have a positive mindset. I think that's where therapy and things like that come in to kind of help individuals really kind of take hold of their mental health. But I think that I would challenge people to have a more, maybe a more positive outlook, a more positive um perspective, and hopefully, with that positivity and whatever other tools, and I know we want to get into some coping tools, it, people can start to see, to move away from that hopelessness that we talked about in the beginning. That really seems to be at the root and at the core of some of these mental health concerns, such as like anxiety and depression.
Yeah, and it's and I think we're both saying the same thing, but I think that it's also worth saying to anyone who's listening. It's not also to take away from anyone's experience too,
Mhm.
because the reality is, one thing that maybe many people who are tuning in and you and I share in common is that we have a chronic physical illness.
Mhm.
So we're not really speaking from, oh, just do that, just get better, just
Right.
be positive, just stop thinking this negative thing. Because the reality is that the situation itself is pretty darn negative.
Mhm.
Like
Mhm.
if we're honest about it, right? So it really doesn't take away from why people are feeling hopeless. And the reality is that people have every right to feel hopeless about it. For me in particular, I look at the fact that I have a chronic condition that has not been named. I haven't been able to find one doctor that can tell me specifically, this is what you have. All I know is that I wake up more days than not with joint pain all over, right?
Mhm.
Whether that's even as I'm speaking to you right now, I have a spasm, coming up, radiating up and down my neck, right at this moment. So, uh, it's pretty darn negative because there's some days I will want to go to the gym. I want to go for a walk. There's some days I want to do certain things, and my body literally says, "Not today, honey."
Mhm.
Like you need to rest up a little bit. Or the days where we were talking about with lupus, if I'm under a lot of stress, I'm worried. I'm anxious about something. I have a big meeting coming up, and I'm planning. I didn't get enough sleep, or I'm just overthinking. The reality is that it does exacerbate the pain.
Mhm.
So in those moments, it's very discouraging. You're thinking about the future. You're thinking about, if do I have to deal with this for the rest of my life, all of my
Mhm.
life? And is it going to get worse?
Right.
So it is very common, although it is not, we don't want it to be a norm for anyone, but it is very common for people to experience that hopelessness that we talked about. So there's value in validating that as well.
Mhm.
But I think what we're also saying is that, and that we know that that's a high possibility that that can happen, right? But we're also saying that they're a major contributor to support, or so that you don't have to deal with the chronic illness and a mental illness, is
Mhm.
tapping into different things that can help you stay motivated or decrease your hopelessness.
Yes, yes.
Yeah.
And so I want to get into some of those things.
Yeah.
So let's
Mhm.
talk about some of these, I know coping strategies tends to be like the coin term, but some of these coping strategies that individuals, I mean, we're talking about individuals with chronic illness, but I would say, anyone really, right, who is experiencing, whether it's anxiety, depression, other mental health concerns. But what are some strategies where people can employ to kind of, better manage their mental health?
Yeah. Well, I will say that just like I said, the way people respond to their trauma is different. I will also say that the way to intervene for people's trauma or stress, mental, whatever we want to call it, is
Mhm.
also going to look a little bit different. So it's not a one size fits all, because I know how some, I've heard many times people say, well, I tried that and that didn't work, right? Well, it may not necessarily work for you, but then it'll work very effective for someone else. So what happens is, I think the first thing I would say is for people to take a moment, do a self-reflection, and ask yourself, what has worked for me in the past? What do I typically enjoy? Even if you
Mhm.
no longer enjoy it, it's important to say what you used to enjoy. And the reason why I say that is because if someone is, significantly depressed or clinically depressed, and there are levels to this depression thing, but if someone is, clinically depressed, that means that they're past the threshold. The, that person may not enjoy the things that they used to enjoy. So
Mhm.
it's actually quite normal that someone will say, well, nothing works. I don't like anything anymore right now. So focus on more of what you used to enjoy. So
Mhm.
if you're connected to the warm weather, then it's probably a best bet for you to be out in nature, take walks. Those are the kind of things that'll work for you. If you don't like the heat, then you don't need to you don't need to
Right.
do outside meditation and yoga. That's not for you. That's not for you. You don't like to work out. Yoga could work for 10 million people. It's not going to work out for you because you don't enjoy that, right? And
Mhm.
that's okay. So, doing a little self reflection, a little inventory on what are the things that I like and what are the things that I don't like. If you get an opportunity to speak to a professional and create a treatment plan with that professional, and that can be a counselor, psychologist, a social worker, etc., those individuals can help you and guide you and say, okay, these are the things that you like. So based off of my knowledge, this is what may work for you. That's one of the major
Mhm.
benefits of working with a practitioner. But some people are not ready. And I recognize that as well. And that is okay if you're not ready to see a therapist, if you're not in that space yet, you're not ready for change. There's nothing wrong with that either, because the reality is, in order for the mental health portion with the therapist to work, is that somebody has to be in, they have to be ready, they have to be in the right space to do it. So if a person is not ready, one of the things that I recommend that provides immediate relief, and most people, either they don't know how to do it correctly or they don't really value it as much, as deep
Hmm.
breathing. I know that that's a typical one that we talk about all the time, but deep breathing, what deep breathing does, and the reason why it's so effective, is because it tricks your brain.
Mm.
And I tell people all the time that you can, this is one organ in your body that you can manipulate to do whatever you want. That's why I love the brain so much, I guess. And so I'll give an example. If you and I, Rita, we both started laughing, cracking up laughing right now, ha
Mhm.
ha ha, nothing funny. We're not really laughing at anything. Our brain cannot distinguish a real laugh from a fake laugh. So immediately, just us pretending to laugh, we are going to naturally deposit dopamine, serotonin into our brain, and it's going to change our mood. So that's why we can trick our brain. And by deep breathing, and what I mean by deep breathing, nice deep breath in through the nose, and more like a sigh of relief out of the mouth, like a like that. By doing that over and over, you're telling the brain that I am at rest stage and I'm calm, even though you're
Mhm.
not calm. And I think the hardest part for a lot of people to believe that these techniques work is that they think that they have to believe it for it to work. No, you don't. To trick your brain, you don't have to believe it to be true for it to provide the effectiveness that it needs to. But you have to be consistent with it. So it's not, I'm going to just do deep breathing right now and I'm like, oh, it didn't work. You have to stick it through. You got to do it for at least 5 to 10 minutes, and
Mhm.
you will experience relief, but you have to measure your relief. So if I was feeling, and sometimes that's another reason why people don't think that these techniques work, is if I tell you right now, Rita, I'm anxious, the question that you can ask should ask me, well, how anxious do you feel? From a scale of 0 to 100. And I would say, I feel 95% anxious. Okay, let's do 5 minutes of deep breathing. After I've done 5 minutes of deep breathing, I should scale myself again. So, how
Mhm.
do I feel? I feel 75% anxious. The goal with deep breathing and many of these techniques is not to get you from 100 to 0 in 5 minutes, you know. So the fact that it went down by 20%, you already have supported yourself. And that's the thing with mental health interventions, that you are experiencing change at small increments that sometimes it's
Mhm.
hard to tell that something is shifting. So you have your deep breathing. The other thing that I would recommend everyone look into is EFT tapping.
Hmm.
Google it or
Okay.
YouTube. EFT tapping. It's very simple. It's in the family of acupuncture, right? Eastern medicine. And what it does is that you're touching very particular points in your body that
Mhm.
are attributed to stress and distress, to fear, to worry, and the list goes on and on and on, right? And the moment you touch those parts of your body, you're telling your that part of the body that connects to that emotion that I am okay.
Mhm.
So the EFT tapping, you have the top of the head, you have here, the top of the brow, here, here. That's it.
That's effective. I feel like it sounds like, I mean, I'm thinking, I don't know what, I'm not an Eastern practitioner, but in my mind I'm like, I feel like it could distract. I'm looking at it more of like the distraction as well too. Like, okay, something's going on, but I'm distracted by kind of tapping around,
Yes,
and that could be a
I've heard that.
calming. Yeah.
I've heard that. I've heard clients when we were doing it, they're like, I'm so focused on this tapping that I completely forgot what I was talking to you about 10
Right.
minutes ago.
Right.
It could be a
Oh.
distraction, but it's very effective. It's it's extremely effective. And
Yeah.
the reason why I know is because I scale people all the time, every day. I have yet to meet one person that we did the EFT tapping for a few times, that is, and that they didn't see a difference. And when I say difference,
Mm.
and I really want to put the disclaimer out there, we're not talking about from 100% to 0% in 10 minutes. We're talking about maybe 95 to 55% to
Mhm.
45%. But if you continuously do it, you can get to 0%.
I
Yeah.
like that. I like talking about some of these other like modalities because I think especially in the Black community, we don't necessarily get exposed to a lot of, Eastern medicine like techniques. So something
Mhm.
like that, maybe I could have seen it in a movie, but it's just like I don't know what this is about, and not even really consider it as being an effective coping tool for,
Yeah.
myself.
Yeah, yeah, and it is effective. And like you said earlier, um, I'm not going to say that it's specific to chronic illness, right? It's an intervention. It
Mhm.
just so happens that people who who have a chronic illness, it works really effective for them too. And I've also heard some people that say that the areas that they're experiencing pain, they've also physical pain, that is, they've also experienced some relief from it as well. Because what happens is, and you know this, and because we're both dealing with some things as well.
Mhm.
When you are feeling something physically, the moment your mind and your brain connects to the physical symptoms, your mind can technically exacerbate the severity of the pain.
Yep.
Not intentionally, of course, but what happens is you focusing so much on that pain that if the pain itself is at 5%, your mental capacity or incapacity capacity,
Mhm.
you know what I mean? The reality is that it will make it feel like it's at 10%, right? And
Right.
so there's a lot of power in challenging your mind, right? And so a lot of people also experience physical relief. The other thing that I would add on to this is words, using your words out loud, aloud. There's a lot of power in that. And so, one of the things that I have clients say all the time is a very specific statement. It starts with, even though blank, I choose blank. So even though my illness, whatever that illness is, my lupus, my fibromyalgia, my rheumatoid arthritis, my cancer, whatever the situation, even though this ailment makes me feel sad, depressed, hopeless, I choose hope. I choose peace. I choose
Mm.
healing. I choose to feel good. I choose to feel vibrant. And you say that over and over and over. You don't have to, again, you don't have to believe it for it to work. There's something powerful about you saying something out loud, you putting it out. It's a part of law of attraction. You put something out there, it comes back to you. But then also your brain says, if this person who owns this body is saying this over and over and over, then it must be true.
Mhm.
Your body starts to shift.
I like that. I like that. Yeah, we hear a lot about like the power of the tongue, the power of words. But I think what you said was spot on for me is that you don't have to necessarily believe it. And I think sometimes we're tied to like, what if I say it, but I don't believe it, like it's not really gonna work, so I'm not even gonna bother.
Yeah.
But I like that. Sometimes I guess, if you say it enough, maybe you will start to believe it, right?
Fake it till you make it.
Right.
Yeah.
Now, I want to ask about, emotional support, right? Because, we know that when it comes to dealing with like mental health, mental illness, it's great to have certain things in place, certain strategies in place. You have your therapist, you have your coping, techniques. But how important is emotional support for an individual who's, dealing with, mental health concerns, whether it be anxiety, depression, or just something else?
When you say mental health support, you mean a community support, outside,
Well, no,
outside support, or them for themselves?
Well, emotional support, whether it's coming from family members or whether it's coming from friends or whoever, but how important is emotional support for an individual who is dealing, like, again, we're talking about chronic illness, but we know, since we're talking about mental health in general, right? Doesn't matter if you have, I guess, chronic illness or not. If you're dealing with like an anxiety, a depression, or some other mental health like concern, is how important is someone receiving emotional support, whether it's, some people receive emotional support from their pets, some of them receive emotional support from family, friends, their job, even, if they're lucky to work someplace, that's amazing. But I guess, what does that do for someone's mental health to receive this kind of like emotional support?
It's extremely valuable. I'm not going to say that no one is capable of thriving
Hmm.
without emotional support. I wouldn't go as far as to say that, but I can confidently say that most people thrive with emotional support.
Okay.
That I can say. A.R. Bernard, Pastor A.R. Bernard says it best, that we're not meant to grow in isolation, right? That we are meant to grow in community. And
Mhm.
that goes the same thing when it comes to mental health. And that's the reason why the seeing a therapist is so powerful, because you have someone who's on your side, who's committed to your well being and willing to guide you through. And that matters. So what it does is that it makes you feel, of course, like, as the obvious, right, is that you're not alone, right? But then it also gives you an outlet.
Mhm.
So the reason why talking is a strong coping mechanism for people is because oftentimes things are bottled up. They're stuck in here. They're stuck in here. The reality stuck everywhere. It's stuck in your bones. It's stuck in your muscles. It's stuck in every single organ of your body. You're not just experiencing stress, in your mind and in your emotions. It's a whole body experience. And so by talking about it, what you do is you're. And so in Creole, we have an expression of débarrasser l'estomac, right? Which
Mhm.
literally means to unload you're off of your chest, unload off of your body. And it's extremely effective. So, with you talked about having an emotional pet, right? A support animal. You talked about family, friends, maybe religious community, seeing a professional. No matter where it comes from, that presence of knowing that somebody or something has my back and is on my side, and I can
Mhm.
unload in that safe space. That in itself is extremely supportive. I have seen a lot of people move forward and move on because they had a community with them,
Mhm.
in a trusting community, not just have people around, but a trusting community, a community that they felt safe in. And I always tell people that I think that anyone can get through a traumatic event, including chronic illness, with the right support.
I love that.
Yeah.
Okay. So, what advice would you have for an individual who's recently diagnosed with a chronic illness and they're, experiencing, or they feel like they're experiencing mental health symptoms, right? And they're a little bit reluctant about, whether or not to get help, or what kind of help, because again, this is also new. They've just been confronted with this, like their
Yeah.
world has just been like shattered. They're just in a state of confusion, but they've recognized that they're already experiencing, symptoms because of the trauma, right? The
Yeah.
traumatic news that they received. Um, so I guess, what advice would you give with an individual who's struggling with all of this, um, and is wanting to get some sort of assistance?
Well, the first thing I would say is similar to what I was saying earlier, that everyone's experience is valid. So, which also means that to let that person know that even their hesitancy to get in mental health support is okay. Wherever they are, they're exactly where they're supposed to be. I think what the first recommendation I would have is acceptance. And when I say acceptance, I'm not saying acceptance in a positive or negative, like, oh, this is good, this is bad.
Mhm.
Accepting is acceptance, the clinical definition of acceptance is sitting with our truth.
Mhm.
So that is extremely helpful to move on to the next stage. So if your truth is at the moment that you need to go through the stages of grief, right? Like you need to be angry, just be effing angry. You know what I mean? Like curse the whole world, curse anyone and everybody. Like that is okay. If the your stage right now, what you need is to stay away from everyone, to isolate for a little bit, and that's where you are, that's fine as well. Um, I think that what happens is that when things happen, when they first happen, everybody has a strategy. Everyone said, do this, do that, do that. And instead of allowing the person to just be, and when you can just be, when you give yourself permission to be,
Mhm.
then what happens next will come more naturally for you. Like,
Mhm.
okay, I do want to get some support. I do want to try these coping mechanisms. But in the beginning, after oftentimes I find people that want to do everything, right? They want to do the self-help, they want to do all the medicines in the world, they want to go to all the doctors, they want to do all the research, they have the library 24/7, and that's okay for them to be in that stage. And then there's some people that completely retreat and they want to do nothing, right? And that's okay too. uh, the only thing I would say is that when you get to, month 3, going month 3, month 6, and you see that you're still there at that first stage, then that's when you may want to start looking at some of the coping mechanisms that I talked about earlier. Talking to somebody that you feel confident that they will not share the information that you've shared with them, that you trust and you feel safe. Then you may want to ask them, what do they think? And believe that when you have somebody that truly loves and cares for you, that even if you can't see what they're saying to be true, the fact that this person is on my side, I'm just going to do what they're saying just because I know so and so is on
Mhm.
my side. But that's when you get to, like I said, stage 2, where you're at the next phase. But in the beginning, all is good. Whatever you do.
And I like that you said that because I think a lot of times, I don't know if it's society, I don't know, like if it's friends, family, the TV, whatever it is that we're relying on, for information and guidance in life. A lot of times we feel like we have to feel a certain way. We have to use a particular method and that we're not allowed to sulk, to
Mm,
feel, right, and that we need to always have somebody in our face, like we can't just be, like you said. And so I think
mhm.
it's so important that you said that, because it's in a sense, it's people now, I feel like, are able to give themselves permission to say, you know what, I'm in a slump right now, all of this just happened to me right now,
Yeah.
I don't want to see anybody, I don't want to talk to anybody.
Yeah, forget those therapists. Forget this. Do they know what I'm going through? Listen, it's all good. It's all good. It is all good. And it's okay. That's what I truly meant earlier when I said about acceptance. Acceptance is being connected to our truth and sitting with our truth, however ugly that truth may be. That is the true definition of
Mhm.
acceptance. That I accept that this is where I am right now, and it's okay for me to be here right now.
Okay.
Yeah.
So, Dr. Flo, I know you talked about this amazing practice that you have. And so I want to give you some
Yeah,
time to
amazing.
just shout it out. Let us know, a little bit more about how we could get information about your practice. Maybe somebody's tuning in and they're like, whoa, I love Dr. Flo. I hear there's acupuncture over there. I want to experience, GTR. So tell us, how can we find you on social media? What's your website? How do we book? All of that.
Yeah, so I'm going to be honest. Let me just put that disclaimer out there that at GTR and many other places, the reality is there's a bit of a wait because,
Mhm.
as we all know, there's mental health is a hot topic right now, and as a result, many people, and it's a good thing, many
Yeah.
people are seeking the support that they need, and they're becoming a little bit more open to support, which means that a lot of the providers are booked, right? And especially if people are looking for a person of color, they want to be gender specific, things like that. So let me start off by providing some general resources, because I
Okay.
always tell people that it doesn't have to be here. I just want you to get the help when you're ready for it. As long as you're ready, you feel like you're ready, just jump in. So there are the common sites such as Psychology Today. A lot of people know about that. What I like about Psychology Today is it allows you to refine your search and put your insurance, your zip code, and then you can take a look at a few people's profile. And you can also refine your search to who has current availabilities, which is nice. Then there's therapy for Black girls. There's therapy for Black men. I fully endorse those websites. I can't say I endorse any one particular practitioner, but I would say that they have pretty good people out in the field that are listed on the sources. And if you're in the New York City area, you can also call 311. And New York City Well has all the clinics, especially the Article 31 and the group practices. They're all listed on the New York City Well website. GTR were also listed on there, so that's an amazing platform. Le Baptiste Sentimental has their website up now with Haitian Creole providers. So if you're looking for someone
Good.
specifically for yourself, your family, your parent who speaks Haitian Creole, with Baptiste Sentimental has a nationwide directory for Haitian Creole speaking providers. So definitely want to check them out. And GTR's specific information, our website is www.gtrinc.org. That is our website. Our Instagram is Instagram, Facebook, Twitter, all those places. Oh, we on TikTok. We on TikTok now, guys. We are on TikTok and it's GTR underscore org. Telephone number is 800-461-9350. We have amazing practitioners here, really well trained. We specialize in trauma. I'm not saying if you come in and you don't connect to your particular situation as being traumatic that we won't serve you, but our focus and our modality is really on providing trauma treatment. And if you call us and do have a wait list and you don't want to wait, the good thing about our admin staff, and I love them for it, they will help you find another provider. So we have a few places that we know. You tell us what insurance you have, and we know some of the places in the local area that take those insurances, and we will provide you with a referral.
I love it. I love it. Well, Dr. Flo, thank you so much for coming on and
Thank
sharing your
you.
knowledge, and sharing those resources, especially. I really do respect, the fact that you highlighted that, listen, this is the reality that's going on in New York. So, let me give you guys some resources in the event, because I
Yeah.
know that there is, it's a good and a bad thing. Like you said, people are becoming more aware of mental health, and they're wanting services. But then what ends up happening is that if you're looking for culturally competent individuals, and I can only assume that the influx, creating maybe even some burnout with a lot of the practitioners.
Yeah.
So
Oh, yeah.
yeah, so so I
Yeah.
think.
We're doing a lot even here because, we're mental health practitioners, but we have our own stuff too. So we encourage everybody here to go to therapy. We encourage naps during the day. We tell
I
people,
love it.
therapy room, go in the therapy room, block it off for an hour, take yourself a nap, re-energize yourself. And then our acupuncture services that we now offer, amazing, by the way. So if anyone, the good thing about the acupuncture is that you don't have to be a current client. If you just want to book just
Okay.
acupuncture, you can reach out to us for that as well. And the staff, we take part in acupuncture too. I've been trying to get guys out there. I've been trying to get Rita to do acupuncture because
Listen,
it's not
I'm
just
coming.
for mental health. If you have a chronic illness, acupuncture is actually very effective. So try
I'm
to-
gonna hit you up after this, and we're gonna book an appointment. We're gonna
Yes,
book an appointment.
please, please. We'll put you on the schedule.
Yes. Oh man. Well, again, I am just so excited that you were able to come on to just talk about this very important topic, because I think,
Mhm.
we talk about a lot of different aspects of chronic illness here, but I really for me, especially that mental health component is so critical. And so I'm really
Yeah.
happy that you were able to come. And I would even say like demystify a couple of things for people, right? Individuals
Mhm.
who, a lot of times, again, we're influenced by what society says and social media says. And so a lot of times, we're creating a lot of issues for ourselves because we're so focused on what everyone is saying that we should be doing. And so here we have, our licensed professional, our doctor, who's just like, listen, just be. And I love that. Just
Yeah,
be.
yeah. And everyone is gonna respond different. So you can't really just go. I gave you guys three strategies, and
Mhm.
maybe all three strategies doesn't work for you. And that's okay too. Maybe you may be different, or you may be in a different position in your life at this. That's you're not really connected to those things. I just gave three that I know has been our go-tos here,
Mhm.
and I know that they're tried and true, but everybody's different, and that's what makes us a beautiful, that's what makes us unique, right? So we can't just go on social media and just pick up all of these items and say I'm going to
Right.
do all of them. And for some maybe that might work, but for some it may not. And that's where you get that self-awareness. You try out a few things. I like this one, I don't like that one. And the things that don't work and you don't like, you don't have to keep doing them.
Right.
You really don't.
Right. I love it. I love it. I definitely want. I'm just going to find another way to bring you back on here, because again, this is. I feel like we can't have these, open, honest, and candid conversations without bringing in the mental health component to it, because
Mhm.
it's just so critical. I think it's just so critical, and so I
And there's
really
so much
do.
to share. We can only
Right.
speak for so much in these couple of minutes, but there's
Exactly.
so much to talk about. Yeah.
Right. So there's so many different aspects, and we didn't want to overwhelm you all, because then we'd be here for 3 hours, and
Or
we
for
don't have
years.
3 hours. We don't have all that time, but we definitely will have another segment on it where we'll bring our resident doctor back, and we can go a little bit more in depth. So if there is any particular topic specifically within the mental health realm that you all are interested in maybe learning more about, definitely send in those questions. You could DM us at Black Ivy Media. You could send us an email at info@blackivymedia.com, and we'll field the questions. We'll have our conversation with our resident doctor here, and we'll see what we can do with respect to bringing forth that information to you all. Um, but again, everyone, thank you so much for tuning into another episode of Sickish, the podcast where we have honest, candid, and open conversations of navigating chronic illness. It's your girl, Rita Pierre. And again, Dr. Flo, thank you so much for being on this show. And we'll talk to you guys next time.